Angelman Syndrome, an investigation on its effects on the nervous system. What does this kid, this guy, this little girl, and this young lady have in common with Colin Farrell's son, James?
The boy is 7, is that right?
James is 7 years of age, and Henry will be 2 on October 7th. And James, just a quick shout out if I can. James has a condition called Angelman Syndrome, and it only affects 1 in 30,000 children, they say. So there's not that much funding.
I've never heard of this. You're saying
really rare.
Angelman
Syndrome. Really, really rare.
And how does this manifest itself?
In fine motor skill, delay, and lack of speech. And I mean, there are various levels of it. My boy happens to be very highly functioning. He doesn't have any verbal speech, but he walked just short of his 4th birthday, and he's an incredibly happy child. And the majority of children with Angelman Syndrome share a really, really happy countenance, which is a really good thing.
That's right. Colin Farrell's son James has Angelman Syndrome, a genetic disorder. Angelman Syndrome was originally described by Dr. Harry Angelman in 1965 and occurs in approximately 1 out of every 12,000 births. Dr. Angelman was a British pediatrician who discovered the syndrome while treating patients in his clinic. He found 3 children with seemingly different disorders and was able to link them together. Dr. Angelman saw this painting and thought the boy resembled some of the characteristics of the syndrome he discovered. Angelman syndrome was originally named Happy Puppet Syndrome by Dr. Angelman. It was later changed to both honor Dr. Angelman and to appease parents who did not like their children referred to as puppets.
Is it easy to diagnose it away from autism? Because that category is quite broad.
There's a wide spectrum. There's a high level of misdiagnosis, and it usually gets misdiagnosed as cerebral palsy because a lot of the characteristics are the same. Yeah, the same characteristics show themselves. James started having seizures really early, and that was it was actually when a doctor saw how happy he was like, does he always smile this much? And I looked at him, James was going, and I went, yeah. Does he like water? And we said, obsessed with water. And he said, has it been tested for Angelman? I said, no, he's about 2.5, I think. And they tested him, and that was it.
Angelman syndrome is a complex genetic disorder that results in severe developmental deficiencies and physical challenges and abnormalities. In the United States, it appears to happen more frequently among Caucasian Americans. People with Angelman syndrome will require constant care for the rest of their lives.
Do they know what causes this?
They don't know. I mean, they do. They don't know what the cause is, but they know the mutation, the genetic mutation of the 15th chromosome.
Angelman syndrome affects 1 single gene, and that makes it much easier to understand than, say, autism or schizophrenia or Alzheimer's disease, where many genes or environmental factors are involved.
In order to understand Angelman syndrome chromosomal issues, you must first understand imprinting. Paternal and maternal gametes imprinting distinct regions from one another, but the imprinting from a maternal and paternal chromosome remains the same. Every somatic cell of the offspring keeps the same imprinting as the original zygote. This means that the genes that are paternally imprinted are only expressed on the maternal chromosome, and genes that are maternally imprinted are only expressed on the paternal chromosome. On the other hand, gametes reimprint their chromosomes according to the gender of the offspring. The classic examples of disorders involving imprinting are the Prader-Willi syndrome and the Angelman syndrome. 2 syndromes that present very differently but have similar chromosome changes. One region that is the maternally imprinted and another region that is the paternally imprinted. When a chromosome 15 with deletions is paired with an imprinted chromosome 15, the genes that are expressed in the imprinted region no longer have a non-imprinted set of alleles on the chromosome inherited from the other parents because they were deleted. If a paternal chromosome 15 with deletions is paired with the maternal imprinted chromosome 15, the outcome is Prader-Willi syndrome. If a maternal chromosome 15 with deletions is paired with the paternal imprinted chromosome 15, the outcome is Angelman syndrome. The same deletion with different imprinting results in two very different syndromes.
He will grow through this? Is that the idea now?
No, now it's just physical occupational speech therapy, you know, a life of therapy for him. And, you know, you just kind of watch him on his path and see where it takes him. And
This is Cole in the physical therapy. He's getting trained by the specialists. They're there to teach him how to use his muscles. They're preparing him so he can learn how to walk. And also in therapy, they're trying to help him with his speech pattern. They're showing Cole currently using a walker to go across the floor.
A lot of laxity, a lot of low muscle tone. So working on improving his strength, his coordination, his balance.
Communicating for Cole is a tougher challenge. But when the little guy waves, everyone knows that he's saying hello.
Weaver has a mouse that mimics most of the symptoms of Angelman Syndrome, so it's missing the same gene, UBE3A. The mice have muscle issues, they have seizures, it's very similar. And what Dr. Weber found is you can compensate for the loss of the UBE3A gene. So he actually turned on a different gene, and when he boosted that gene in the mice, they recovered from all of their symptoms of AS.
Communicating for Cole is a tougher challenge. But when the little guy waves, everyone knows that he's saying hello.
You don't know what the life is going to be like for them. You know, will my child ever walk? Will my child ever learn to communicate? Will my child have seizures? Will my child die from a seizure? We lose kids every year because they have a seizure and they don't come out of it.
We were able to genetically cure it in the mouse. So parents that have children that have Angelman syndrome should be very hopeful. There's a treatment out there. We just need to find it.
Children with Angelman syndrome are more susceptible to seizures, unlike other children. You have children that have seizures that are mild, while others are more threatening.
A cure for AS really is going to be a gateway to a cure for other neurological disorders, for things like Alzheimer's, for autism, for anything that affects learning and memory. So this is a chance where someone's investment could really pay off and they could see it.
Do you want Play-Doh, Finn?
To drink.
Yes.
No, to drink.
Because of Dr. Weber's and others' research, it is possible that people with Angelman syndrome can recover mental capacity and hopefully become more productive members of society.
I'd say my boy's a really happy boy, and I've in my life been around some children who are sick or suffering, and to be honest, my boy's doing really good.
Well, I'm glad to hear that.
Thanks.
Glad to hear that.